Norley. I am so excited to be here with you today, as introduced by our mutual friend, Camille Lasker, who I've had on this podcast. And actually, this is a subject I haven't really dived into before. So that makes me really excited. I love learning and talking about new things. And I feel like I know a tidbit about this subject, but to hear and listen to you today, I'm like super psyched about it. So we're going to talk about all things that have to do with surrogacy and all things that have to do with kind of just like having babies and different ways to do so. You are a psychologist. You are a family therapist. And tell me more. And I'm just going to like hand it over. So give me your background. Tell me how you became an expert in this subject and why. I mean, I've read your story and I know a little bit about you, but better from you and for everyone to hear it from you. And I think there's something extra particularly special about being an expert because you wanted/needed to be. There's something that makes that different than like I went to school and became an expert because that was what I thought I wanted to do. So I think that is sort of resonates with your story. So let's dive in and just sort of tell me who you are and why we're talking and why you are the expert that you are.
Okay, great. Thank you, Amy. It's such a pleasure to be talking to you today. I'm grateful for you taking the time and having me on, and thankful our lovely friend Camille introduced us. So I appreciate that. I always love the opportunity to talk about this, especially, with people who have a real curiosity and interest in the topic. For me, in terms of how I got here, I was a marriage and family therapist, master's in psych, specializing in anxiety, infertility, depression. And as time, went on over my 13 years with the clinical practice, I really started to hone in on, the infertility patients and what women go through on their fertility journeys. So I started to get my feet wet a little bit with the clinical experience and talking to people about their experiences. And then I had my own about 4 to 5 years of infertility.
Did you always want to be a therapist? Did you always want to be a family therapist? Were you always interested in that exact, subtopic of therapy? Like how did you end up on that road? Because I was a psychology major in college, but it could have been anything. So, like, how did you end up going down that road?
It wasn't always the thing. I went to USC. I majored in comm. I was excited about being in entertainment and styling and fashion and that kind of thing. Graduated from college, went straight and worked for a company called Harrison and Schriftman, based out of LA, where I was doing like celebrity wrangling and
with Laura.
Worked in the press department, and we were doing all these events and like standing outside with a clipboard and so I was excited about working in entertainment. And I also had jobs after that at like William Morris Endeavor, working in in the mailroom at some agencies. And my mom was a therapist, so I always had that experience of kind of having awareness around psychology. But I would say it wasn't until one of my best friends from growing up got sick with Hodgkin's lymphoma. She was at UCLA at the time. And I took a little bit of time off my job working. At that point, I was working in styling and fashion to help with her as she was in the hospital undergoing a stem cell transplant. And it was, I think, at that point that I felt like, it would resonate with me to do something meaningful when it comes to relationships. Not that these other things weren't meaningful, but, I'd always been someone that like has a curiosity about people. I love to listen. I love to learn about people, and I love to nurture in any way I can. It's kind of always been something that's been important to me, that's sort of been instilled in me through my parents. And so I decided, I think I want to go back and get my master's in psych, where I can really help people going through challenging times, as I kind of had saw my friends struggle. And I think after watching that and how dark that was, especially at, 23 or 24 years old, I was thinking, I feel like it would be hard to go back to do something that didn't really speak to my heart. Mm-hmm. So I ended up going back, getting my master's. I was still working in styling at that time because I was in school, and then I had to do all those hours, finally graduated. And then when I started my practice, I started just kind of like helping people. I worked in a variety of different, capacities. Like I worked in a treatment center with people who are, very more severely mentally ill. I worked in addiction. I worked in, kind of people who are just struggling with anxiety, depression. And so when I opened up my my private practice, it was a lot of like relationship issues and, sort of generalized anxiety.
Did you immediately start your own practice, or did you work in another person? Like, did you work in a bigger practice?
So no. So essentially what you have to do when you're getting your hours is you need to work in private practice underneath somebody.
Right.
And so I was supervised by my supervisor at the time. I worked in her practice. And then
in Los Angeles.
In Los Angeles,
Okay.
yes. As soon as I was licensed to become a psychotherapist, I opened up my own practice, brought my patients with me, and then just grew from there. And I did that for about 13 years.
Oh, wow. And how did you know that you wanted to have your own practice? I mean, that seems like a big deal. And my guess is you were still really young at the time to go into your own practice.
Well, I had the experience of watching my mom, who also had a practice. And I met a lot of people that I interned with and that were my colleagues. And, we had all kind of talked about wanting to have our own practices. And really, I worked in treatment centers. I worked in clinics in a variety of different atmospheres. And like really what I appreciated is working one-on-one with my patients. And that was something that really private practice offered me. And also, it did offer me a choice in the demographic I worked with and being able to kind of like hone in and focus and make it more of a specialty and people that I felt were a good fit for me, as opposed to being in like a big setting where people are, just coming through intake and you work with what you work with. Right. And I felt at that time I had enough training, several years that I was ready to kind of go out on my own, have my own practice and just kind of have my own business and start from there.
Yeah. And was part of the reason, like you made it sounds trite, but like made your own schedule and you had control over your life at that time. I'm guessing you were early 30s at that time and figuring out your life, or?
Yeah, I was about like around 30, 29 maybe.
Yeah. Yeah.
And of course, it was nice to be able to make my own schedule and have autonomy around that and, be able to see the amount of people I wanted to see and, be able to charge a fee that I thought was appropriate. And maybe I was in my late 20s, but around that age. Yeah. So that was definitely a benefit of being able to have your own business, make your own schedule and have autonomy that way for sure.
And empowering.
Yeah. Yeah, absolutely.
Yeah. Okay, sorry. I keep pausing you because this is really,
no worries.
It's all really fascinating to me. Okay, keep going.
So at that point I was a clinical therapist, seeing patients. I worked for a little bit at a program at USC, while kind of working in my own private practice with some of the students there. And then, at the same time was kind of started my own road towards growing my family. I got married in my early 30s and my husband and I decided to start trying to have kids. And that just sort of was the catalyst that kind of led me in this direction. I had a lot of trouble being able to conceive. And then it sort of became, once I conceived, I would always have very early miscarriages. I couldn't hold a pregnancy longer than 2 weeks, and did a lot of testing, did IVF, did medicated IUIs, did all the egg retrievals. I had so many eggs and a very high AMH, so I had if you look on paper, like my ovarian reserves were excellent, but the quality of my eggs were very poor. And then that just went from then trying to do all the implantation and having all the failures, early miscarriages. And then, what eventually led me to multiple doctors, multiple tests, trying to figure this out, to eventually going down the road of surrogacy and then having my own, there's so much in that, but having my own babies, which was a surprise via surrogacy.
Okay, so hold on.
Yes.
That was a lot.
How much people want to know about details of like personal experience. So feel free. I just don't want to
and I don't know how much do you want to talk about it? And my guess is you don't mind, but you say what you need to say because there's a lot in there that I would love to unpack as much as you want. So first of all, there's, miscarriages, like so many women miscarry. I've had a miscarriage. I have 3 beautiful boys, and I had a miscarriage in between number 1 and number 2. And it is a horrible experience. It is a horrible experience. Yeah. My mom died when I was 21 years old. And it is one of the few times in my life that I was hysterically crying. I I want my mom. Like it is in one of the few times. And my husband was like, I'm so sorry. That's the one thing I can't give you. Like, it was like, I just want my mom. It was horrible, 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 painful, disgusting, gross, all the things. And I was like shocked that so many women miscarry. And it's like it's like no big deal. You're supposed to be like, oh, women miscarry. You bleed out a fetus. Like it's so disgusting. It's so painful. It's so awful. And then you're supposed to be just fine and, get pregnant again real quick. Anyways. And no one talks about it. It's like, so the idea that you miscarried multiple times and I mean, the psychological weight and sadness and all the things. I mean, it's just so much. I am so sorry. And the idea that then you just kept going and trying, I mean, that's a lot, Marley. That is a lot. And on top of that you have this training on how to deal with it somehow like is supposed to translate to yourself. I don't even know how that works. You know what I mean? Like you translates to helping others, but like, how does that work on your own self? How does that? Like, is it a 1-to-1 or is it like a disconnect? I don't get it. I don't know.
I am so sorry about what you went through, losing your mom and the miscarriages, and I can only imagine. So I'm, really.
We all have shit in our life. It's what doesn't kill you makes you stronger, and it's about how you. I mean, look at you. It's about how you turn your crappy lemons into lemonade and enjoy the gifts in your life, right? And what we do with it. So that's how I've chosen to live my life and how you've chosen to live yours and then how we learn from others and we make life positive in the best ways possible for sure. So that's what we're doing, right? But like that piece of this that I would love to understand from you, many pieces of it, but right now in this moment is how do you use the training that you had to get yourself through those moments? Like, were you did you or did you just barrel through?
I'd love to sit here and say like my training was super helpful for me to navigate an emotional journey. I would say like 10 out of 10, that's a no.
Yeah, that's what I would think. Like, that's what I would think.
So different. I mean, part of what's nice about like being a therapist too is like really jumping into somebody else and their experience. Yeah. It's really great to not have to like, be so focused on your own.
Yeah, totally.
It's like when you are dropped in a place where you are then kind of surrounded by your own trauma and your own fear and your own sadness or anger or whatever you want to label it. Like it's hard to kind of use that training on yourself because we're all emotional people. And it's so easy when you're outside of something, right? Whether you're a therapist, you're talking to a friend, it's easy to see clear, to see through the weeds and to have the wider perspective and the wisdom of like, different perspectives and to kind of console. But when it's you, it's like you're still kind of beholden to like all the things that go on inside you, whether it's worry or fear or all the things. So for me, I don't think in those moments it really was super helpful. I think the only thing that was at times is I try and tell other people to not be judgmental about your feelings. Just as you would give someone else grace, give yourself grace. Like, especially, around, I think, anger that can sometimes come up because when you're at childbearing age and your friends are having babies and everybody's got a baby shower and your sister or your cousin or everyone in your family, your younger sister is having 4 babies and you can't have one, it's easy to have feelings of like, as happy as I am for the people I love, like, I really don't want to hear it. I really don't want to be crying in the bathroom at the baby shower. Like, and it's easy to be like, don't be a jerk. Like, you're supposed to be happy for somebody. Why are you angry? Why can't you get on, and it's not that you're not, but it's like, sometimes we're just in our feelings and they're normal and that's where we're at. So I think I did try and remind myself of like, even when I was deciding to go towards surrogacy, what I tell my clients now is like, I wasn't 100% so excited, can't wait. This is, the way it's going to happen. And I'm so proud of and happy. I wasn't. And obviously there's a trajectory and that changed a ton. But in that moment, I'm like, this is where I am. And all we can do is move forward. And, not that you want to accept us, being stuck in something, but at the same time, you do need to move through things. And there's no way, it's like the only way around is through. And so I sometimes moving through your feelings is allowing yourself to have them, because what I do see is people get really judgmental about the way they feel and they just want to wish it away. So I think in some way that helped. But in terms of like, going through the process and the grief and the fear and, the frustration with myself, like, I think it's kind of like, doesn't really work so great on yourself, how you can help others.
Yeah. Yeah. And sometimes you just want to look at someone and be like, fuck you. Like,
Totally.
like you're like, why you just don't invite me to this baby shower? Like, fuck you. Or what's that children's book? Like, I must have read it 100 million times to my kids. Like, you can't go under it. You can't go over it. You've got to go through it. I don't even remember that. You know that one? And it's like,
Yes.
and they're like trudging through, it's like, oh, and it's such a life metaphor. Like you just got to slog it through sometimes. And when it's your own like mud you're going through, it just sucks. And like, you can't see the other side. And then you get to the other side and you're like, I'm stuck in, like, I'm just covered in mud. Like I don't feel lighter. I feel heavier. It's hard.
Yeah.
My husband said to my kids the other day, it was one of my older son's friends is just went through a really hard time. And he was like, sometimes life is hard and it doesn't always work out. Like sometimes life is hard.
Yeah.
And I mean, as a therapist, sometimes like it's a hard lesson to teach, but like, it doesn't always like work out, like sometimes it's just hard and you get through it. And it doesn't like turn out with roses on top. And that's a hard lesson to teach your children. It's also a hard lesson that you learn as an adult. That's like part of becoming an adult, and you just have to get through it. And maybe that's, a lesson I learned, maybe having a miscarriage. Like it's not great on the other side. It's just hard and horrible. And it just, you get through it and then you move on, but it sucked the whole way, So I think maybe that's just a piece of life, that like, it's not always roses, but you get through it and you do it. And then you find options and ways to figure things out. So anyways,
but I think
forward
to what you said, like, it's probably the same, like, as you said about grief or losing your mom. Like, it's like, sometimes there's just no way to spin things in a way that feels like something has a bigger purpose or it's for the good. Like, it's just not. And so I think what you said, though, the honesty of what your husband was saying is like, sometimes it doesn't work out, at least in the fertility topic. Sometimes what's even harder, what people don't mean to do, but we're all guilty of it sometimes, is wanting people to feel better and not wanting to just say, this is shitty, this sucks. Yeah, you're right. You may not be able to have a baby. And I can't imagine what that's like. Sometimes we fall into the trap because we want to help of, if you just try this vitamin, if you just try not to stress, if you just, oh my gosh, see this acupuncturist my friend saw. Yeah. And so, sometimes when we try and make things better, it can be more dismissive. So I think what you said about like, sometimes it's a hard pill to swallow, the honesty of like, sometimes things don't work out, but at the same time, it is also speaking to something that that we fear when we're going through that kind of turmoil and challenge.
Yeah. And I especially think in today's day and age where like everything's supposed to be perfect and beautiful and like everything's going to be fine. Like, sometimes not. Like sometimes there's harsh realities and it is the way that you deal with them. And it is the choices that you make on the other side of it that define you. And so you had choices, right? When you were faced with really harsh realities about life, because you never think as a young woman, as a little girl, as a young woman, I'm going to get married, I'm going to have babies and they're going to fly out of my vagina and it's going to be great, and they're going to push out and my husband's going to be there and cut the cord and woohoo, and then they're going to dress them in pigtails. Like you just never think anything different. Yeah. And then you can be faced with really harsh realities and then you figure out who you are, right? When you have to make decisions when the realities change. Yeah. So my guess is, Marley, you figured out who you were and you made decisions. So what happened in those moments when you were faced with your decisions or your options and you decided on surrogacy? Like, how did that come up? How did that, I mean, it's almost like a new thing, right? So in the last however many decades, how did you make that decision? How did you research it? How did you find the person? Like, these are things I don't know about because lucky me, I didn't have fertility issues. So do you tell me about that?
Yeah, of course. So, it got to the point where it clearly wasn't working, and there was some speculation as to why. I had moved to another doctor, which is like my last stop, and she had said it's really hard for us to get embryos at this point. You've been doing this for 4 years, and at this stage, we're getting one embryo every time, and I'd get like hyperstim, and it was a lot for my body. So, she's like, well, we could keep trying, and you can see if maybe this will change, or we can figure out, the exact reason and fix it. At this point, your safest bet of like being able to have a healthy pregnancy and have a child that is made up of your genetics would be to use a surrogate, because, we didn't really have embryos to waste anymore. And, there was an issue potentially with the shape of my uterus, also probably endometriosis, and some other things that may have, just contributed, but we weren't exactly sure. You kind of fall into this umbrella of unexplained infertility. And this was about 7-8 years ago when I was looking for a surrogate. So at that time, it wasn't as much in pop culture. I didn't really know a lot of people, so it was sort of a new thing to me. But I had gotten to the place where I didn't really trust my body anymore. And that was one of the hardest things, because I'd get pregnant and I'd go to acupuncture and I'd be laying on the table and, tears just running down my face, because I'm thinking worried about am I going to lose this baby? Is this going to stick this time? I don't want to be pregnant. This is scary. This feels awful. So I think with the trauma associated and anxiety, it got to the point where it was a negative experience because of all the fear after all those years. So, I was faced with a decision, which of course was still a decision, but the recommendation in order to get to the result I wanted and to be a mom. And now I'm getting into my later 30s, was to go ahead and go that direction. So I'm somebody who when I want to get information, I will talk to everyone. I'll call everyone I know. Do you know a person at this? Do you know a person at that? So I started with that, and I found friends of friends and people I knew that used a surrogate and had that experience. And so I called and I asked as many questions as possible, got a list of referrals, and this is time my husband, was involved, but he was working. And so a lot of it was I was kind of the designated person to collect the information for us. So I went to the law firm by myself. I met with the lawyers, and I just kind of got the information. Who are the best people to do this with is kind of was what my question was, is because I really knew that I was going to need somebody to help walk me through it, advocacy, and all of those things. And of course, the new doctor that I was with, I had the utmost trust in, and this was kind of what she felt was right for me as well. So, it definitely, I had my husband talk to a friend of a friend who was their husband who went through surrogacy, because this is something, he was born in France. And so his family's French and it's not legal there. So it's kind of all new to his family as well. So, we definitely navigated through it. It wasn't an easy decision. We both had concerns about what this would mean. And for me, the major things in my head were am I going to bond with our baby? Is the baby going to love me? What am I going to miss out on by not feeling those having those experiences, feeling the kicks and being pregnant? And how am I going to feel inadequate? And what is that going to look like? How am I going to tell people? And what's that going to be perceived like? And I just had a lot of concerns about what I would be giving up. And at that time, it really felt like a sacrifice. In addition to the cost, I mean, you're looking at the time, another $200,000, which isn't a small amount when you're, having a baby is usually free.
Yeah. And you'd also done so much, put so much investment into this already. Yeah.
Yeah. So I think for me, and I tell my clients this all the time, what it came down to is the number one important thing for me at this point was to be a mom and to have a healthy child. Number one above everything else. And so I felt what is the best decision I can make for the health of my potential child and their future? And I felt by the way my body had failed me, in addition to the kind of home that I am now in emotionally after all those hormones and all the disappointment and the anxiety and stress I felt, I didn't feel that was the best home either. So I kind of thought of it as, this is my first parenting decision. It's not, as now I know with parenting, 99% of the decisions I make are not the easy decisions. They're the harder decisions, but that are the best for my children. And so for me, I kind of try to think of it as this is a hard decision. This is not the way that I would want to go, but I think that this is the best choice for my body and for this potential child. And I want to do something different, because sometimes insanity, is banging your head against the wall, doing the same thing over and over. And so I just kind of was okay, we're going to do it. And we went forward.
And what was that experience like? Did you know the woman? Do you know her now?
So in the beginning, it was hard. I hired a bunch of different like kind of agencies, consulting services, things like that. And so it took a while to find somebody. It'd been about 8 months and I hadn't found somebody yet that would be like the right person. I kind of didn't really know where to start. And one day I got a list from the doctor of agencies and I just started calling myself, like without having somebody help me. And I called an agency and I described what I wanted. And at this time, there weren't more intended.
Like, would you describe what you wanted? How did you describe?
I said, I want somebody who is responsible and who I know will advocate for themselves and my child. And I also want somebody who's empathetic and understands like where my husband and I are coming from. And I absolutely intend to respect them and their family. And this is, a collaborative process. I don't plan to be micromanaging, but I want somebody who's going to very much understand that, what we've been through and that will be sympathetic to that. And, somebody who's kind and warm and kind of like responsible. And, I didn't really know what to ask for. I just knew I wanted somebody that kind of was stable in their life, stable in their family, and that was going to understand that this was hard for us, was going to understand that like relinquishing this control was hard and wasn't going to be dismissive of that. So I sent the agency our photos and information. She said, you know what? I have this woman who's not signed up yet. She just called to inquire and she's not sure if she wants to do it, but I think she'd be a really good fit and you guys for her. So why don't I see if she's open to just doing a match call? And this isn't the way they do it now. Like this was a long time ago. There were way more surrogates available in terms of parents. It was different. But I said, okay. So we got on a match call, myself and my husband.
Like
and her.
Blind dating. It's crazy.
Yeah, totally. And her and her husband. And I knew then that I was like, yes, like 100% yes. Like it didn't necessarily change all my fears or anything like that. But when we had that call, I was like, okay, I think I can do this. I think, this is going to be hard still, but I feel good about this person and her family. She said the same about us. Like for this couple, I'd love to do it. And, when I went into it, I was kind of really insecure about like, is this person going to be the mom? Like, so I was like, let's go through the pregnancy afterwards. I don't know what I'm going to want. Like, maybe I just want the separation and not to be involved. Like, I don't know how I feel, but I definitely felt insecure that I wasn't going to be the one caring. But, we went through the journey, and not that like journeys don't have their challenges, for a variety of different reasons. But interestingly enough, she became one of the most important, most loved people in my entire life. She is the most special person. She gave us the biggest gift I could ever ask for. And her husband was, the day that the babies came, he came to my hospital room and he gave me flowers. And he said, every new mom should have flowers. Aww. And they're just the best family. And she, we don't get to see each other often because she lives up north, but I call her Auntie Beth, and haven't yet told the kids, but they're getting to an age, I think, where they're going to, probably understand. And I didn't anticipate that it would be that way, but I think of who she is and seeing everything we went through together and having that experience of watching them come into the world and the birth and everything. It's just, I think that my life is so different because of her that it's just one of those relationships. It's like kind of like a soul connection, and she will just always and forever be somebody that's so close to my heart. And so I'm really grateful that while our journey wasn't perfect, not necessarily because of her and I, but just a surrogacy journey and everything that entails, there's disappointments and there's challenges, but I was very fortunate to have met her and pass across. And, the reason I kind of do what I do now is because if I could change it, I wouldn't. If I could go back and have a different journey, a different outcome, even maybe carrying myself, I think it was meant to happen. And being on the other side of it now, I feel really grateful.
Does she have kids of her own?
Yes. In order to be a surrogate, you have to have kids of your own. So she has 2 kids. You have to have at least one, but she has 2. And she wasn't sure maybe if she wanted another, but unfortunately she got preeclampsia with the twins because they were twins. And so after that experience, I think she was kind of like, that's a no for me.
And how old are your twins?
They'll be 6 in June.
Wow. Okay. And tell me their names again.
My son is Jack and my daughter is Celine.
Oh my God. Jack and Celine. That's so cute. And tell me how it works. Did you know you were having twins or you found out after?
So no, we knew we were having twins, but it wasn't really intentional. So we had put one in our surrogate, one embryo, and that was her plan. She didn't want twins. We were totally fine with one. It didn't work. And at this point, nothing, she was perfect. Nothing had worked with us. My embryos hadn't worked. So we were concerned, like, okay, maybe my embryos are just like not good. Like, so she kind of wanted to do it one more time, one more transfer. And we had 2 embryos left. And my doctor was like, listen, I usually don't do this because twins are more high risk, but like, let's put in 2 and hope you get one. You know, you do have like I think it's like a 10, 15% chance of twins, but like we really didn't anticipate after all those failures. And we put in 2 and the numbers were a little high, but you kind of never really know. And then we went for the ultrasound and the doctor was like, okay, here's one. You see the sac? And she's like, brace yourself. Here's another.
Oh my God. And boy-girl twins are really awesome. I mean, if you have to have twins, you should have a boy-girl twin. That's like the best case scenario. My grandma's a twin, and my grandma's twin had twins, and my husband's dad is a twin, all identical. And I have 3 boys, and I have when I was pregnant with my third, it was I had an amnio, and because I was 35, and we were on a walk and I was like, this before I had the amnio, I was like to my husband, I'm like, this could be twins. And he was like, why would you even say that? That's insane. Like, why would you even say that? Why would you put that on the word? I'm like, because it could be. And he was like, if it's a twin, I'm shoving one back up there. Like, absolutely not. And then after we had a third boy, he was like, I really think we should have a fourth. I'm like, are you insane? Like, we will definitely have twins and then I'll have 5 boys and I will I will absolutely not make it. I'm like, our chances are so high, but that's amazing. Mazel tov. That's just the best thing ever.
Thank you.
Wow.
Thank you.
And I will say though, as you mentioned earlier, when you start making parenting decisions, they only get harder as they get bigger.
I know
my kids, bigger problems.
Bigger kids, bigger problems. It's like,
oh boy.
Like, mommy like my tushy, but someday it's going to be like, I like the boy and
God. My 21-year-old, I'm like, I can't have this conversation about, oh geez, no, it's too much. It's too much. So what does your practice look like now? And obviously your experience has not only changed you, profoundly in the way that you see yourself and you see your family, and my guess is the way you see the world and all of the things that, we talked about in terms of decision-making and all the stuff. But how has it changed the way that your practice and the way that you potentially work with your patients? Or I guess my question is, how does it shape how you see your future? And the way that you want to move, the way when you look forward and as your kids get older and your family grows and meaning your children grow and grow up, like how does that, do you think about that, or is it one day at a time still? Like, how do you see that?
Yeah, it changed my career trajectory a lot. So I'm actually no longer practicing in my clinical practice. So I'm no longer technically a marriage and family therapist. I still have my license and I still can practice if I need to. I decided I wanted to help people in a more concrete way because at that point I had the clinical, like more emotional experience of helping people navigate. I had my own personal experience, and there were a lot of things in my own journey that I think I saw as kind of like holes in advocacy for intended parents and things that I wanted to kind of be a part of and helping people with. So I, about little over 5 years ago, opened up my own concierge service consultancy, working with intended parents. So I, help them navigate the process, whether they're using an egg donor, sperm donor, surrogate, sometimes all 3, sometimes 2. And so essentially what that looks like is I kind of help them, get matched. I don't usually work with the surrogates and egg donors myself. I have partnerships with agencies and they do the recruiting for that. But I will help them to match with a potential surrogate or an egg donor or sperm donor. And then I'll kind of hands-on help them liaison, navigate the experience. It's kind of like a white glove service where people come to me if they're overwhelmed and they want help, or if they just want someone like to advocate for them, hold their hand, or maybe they're too busy and, they have some kind of high profile job and they need help. They can't be on emails all day. Or, maybe they have confidentiality concerns and they want somebody to kind of like help them be the face of everything that they need to navigate. But essentially, I do that exclusively now. So I
love that.
Intended parents, probably about 25 couples or individuals at a given time. And I've been doing that now for about 5 years. So
Wow.
it definitely changed my career trajectory for sure and opened up a whole new world for me. And that's just kind of, what I do, full time now.
I mean, to me, the best things in life are when they happen organically.
Yeah.
And clearly, this is that. And also, I mean, that's just the answer to the question, right? It's like for every action, there's an opposite and equal reaction. And for every life hurdle, there's like a wonderful lesson that can be had. And if you can turn it into something where you are it's not only like giving back, but it's like shaping your life and growing it and continuing to learn. And like, I just think it's like this ever growing bubble, if that makes sense. That's like,
Yeah.
I
Yeah.
don't know if I'm being clear, but in my head, I'm like visualizing this, like, just like big, giant, like one of those things your kids blow out, those big bubbles that like keeps expanding.
Yeah.
Yeah. And it's so beautiful and it's so wonderful. I mean, this is a world, like I said at the beginning, I don't know that much about. I mean, I know so much about women's health and wellness and obviously preventive care. And I think this is such a huge part of it that I'm really excited to learn about and then to hopefully learn more and more about, because there's a lot involved, right? And there's something so deeply important about our connection to our body. And there's something that you said earlier that really it triggered my brain in a deep way, which was when you were one of the times you were pregnant and you were sitting on your acupuncturist table thinking, what's my body going to do? Is it going to work? Is it going to fail me? And especially as women, there's this, incredible importance that we should have of being connected to our body,
Yeah.
right? And understanding what our body's telling us.
Yeah.
And my big mantra has been for the last 27 years since I've been running this foundation is know you're normal,
Yeah.
right? So it's understand what your body is telling us
Yeah.
and how that changes throughout our life. So your normal is quite different at 6 years old, then through puberty, and then through like the sort of second puberty we go through in our late teens, early 20s,
Yeah.
and then again in our 20s and or sort of later 20s and early 30s. And then if you have children or your body does whatever it's going to do in that time when you might, try to have children and you don't, what is it telling you then? And it's really important to understand that, because if you can't understand like what your cycles are telling you, and then what your uterus is telling you, what your estrogen levels are telling you, what your serotonin levels, what your testosterone is telling you, all the things, it's hard to understand what your normal is.
Yeah.
And if you don't know what your normal is, you don't know what it is when you're outside of that.
Yeah.
And for a lot of women, we can't tell. Like you just can't, because your body's, you don't know. Like you can't get a pulse on it. And that's when you need specialists and you need people to come in and really help you understand. But it's important to know when you need the specialist to help you understand. And then it's important to sort of figure out how to get back to that. And when you get to be my age, when you're close to 50, really close, um, it's also important to understand, like, how do you figure out how to regulate back? And there's a long, long history of
Yeah.
just saying, well, too bad. You're almost in menopause,
Yeah.
deal with it. And that's not necessarily true. Like there are ways to figure out how to regulate yourself so we're not absolutely nuts and not sleeping and your period's coming every 2 weeks and it's just a fucking mess.
Yeah.
So I think that moment when you're on the table and you're just like praying and hoping that you find some connection to your body there, hopefully, this many years later, there's ways for women and your help, in ways you're helping them understand, like if you're disconnected from that, there's ways to understand like there are other choices to make where you can have babies and you can have a family if your body just isn't working that way. And not all women's bodies work the same way. It's just the facts of life. My mom and a lot of women back around the same time had a lot of problems getting pregnant. My oldest sister is 57.
Mm-hmm.
So about 59 years ago, 60 years ago, she was having problems getting pregnant. That could have meant 6 months, where she couldn't get pregnant, and certainly not 6 years. And there was a hormone that lots of women were taking. Coincidentally, a lot of women in West Los Angeles. She was living in LA at the time. And it was sort of this microcosm of women. And a lot of them ended up with ovarian cancer. And it was one of those things where it was like who knows?
Yeah.
It was like
that they were taking for like
fertility. It was like an injection. Like, who knows? It was
you mean they were taking for fertility.
Correct.
Is it Clomid?
It was like a cocktail. Like it was like,
oh, got it. Okay. My grandma had ovarian cancer at 40. So I was just curious.
There you go. And it was like a cocktail, and it was like a handful of doctors, and it was like a cocktail with probably Clomid and something else shoved in there. And it was like one of those things. And it's like not enough details that a bunch of these women knew that they were all doing the same thing. And it was not enough of any sort of hard evidence to say that this caused this, but it was one of those things. And it was also, to me, this many years later, and I didn't ever get to ask my mom about it because who knew? And and I didn't, have the wherewithal to put it all together, but it was one of those things where it was like, there was just this disconnect between my body's doing something, I don't understand it, and I'm sort of not going to take the time to figure it out.
Yeah.
And this also on the medical side saying, I'm not going to figure out what's happening with you, and maybe nothing is, and we're just going to shoot you up with something. And I feel like this sense of we're going to go through the process and we're going to figure out what's going on, and we're going to look at all these options and understand what we can do to help get to a place where you can have what you want to have in life. There's a lot of options and ways for women to have big, whole, healthy lives that look at all the different options. And I feel really sad that you went through such a hard time and went through miscarriages and such a, feeling like your body was failing you. I think all these things are just so shitty. And I can picture you going to baby showers and just like, I can picture that. It's like the moments after, when your hormones let down and you just cry in your closet and you're like, And
I think what you were saying about being disconnected from your body, I think the hardest part about that is when we're in times of trauma, usually leading to fight or flight, and our central nervous system is dysregulated. Those are the times when we're most disconnected from our body. So it's like the times where you need to be disconnected to really know what's going on and to be able to like have that be integrated and understand. You're actually the most disconnected because of all of that fight or flight and all of the trauma. So I think that's the hardest thing that I experienced for myself, and that I hear a lot of people experience, is it's almost like the closer you get to that, the more paralyzing it becomes. So it's almost easier to kind of detach from it and be like, it's too much. So I think the thing for me when it comes to the fertility stuff is that like information and like having as much control as you can at the earliest point you can is helpful. Like I always talk to people, young people who are, even I meet people all the time, whether they're like, they're 30 and they're like, oh, we don't want to have kids for a while, so I'm just going to wait, but I can't wait. I want to have a big family. And my question is like, oh, that's awesome. Like, do you know your AMH? Do you know what your FSH is? Do you know your ovarian reserves? Because like, you'll get a sense of where are you like on the range. You could be in a great spot. You could actually be behind for your age, and you have the opportunity, whether it's to freeze your eggs or make embryos if you're with a partner. And your AMH, you can go to your gyno, your OB, and just get labs, AMH, FSH through insurance, and know where you're at least to some degree. I mean, if you're more a little bit down the line, you can go to a fertility doctor. But like this idea of not being able to advocate or not knowing where you're at and how you might preserve your fertility and have the control, as opposed to getting to the point where you're kind of, you're trying to have a baby and then you're hit with a ton of bricks at like, oh, just kidding. Like, try again.
And that's why, I mean, this is a whole nother conversation, but that's also why I have like, I know this is so like not politically correct, but why I have issues with women who are I'm going to have babies in my 40s. And I'm like, if you don't understand what that means and you don't do exactly all the things that you just said, you could end up with a lot less options than you want. And if you know your options and you understand everything on the table, then then go for it. If you do that without even like doing the research and knowing what's on the table, you could have a lot less options than you want. And that's okay if that's what you want. But if you go into it blind, like there's a reason why our bodies are made the way they are. And, I think it's a matter of what you want in life. And that's okay too. Like, I have no problem as long as you know what you're doing. I literally just said to one of my kids today who is he's 19 years old and he's applying to like 17 internships this summer. And my older son was like, he's applying to so many internships. My older son who's like so focused and applies to one thing and he always gets it. And I'm like, hey, the more options he has, the better. If he has 17 choices at the end of the day, he'll pick one. And I'm like, that's how you live your life. Like if he has 17 choices of what he wants to do this summer, I'm pretty happy for him. Right. So I think that's like important. And for women, our bodies are made the way they are. Like, if you get your period for the first time at 12 years old, there's like a reason why, Right. And it is harder and harder and harder to have kids as you get older, assuming everything is functioning and working properly and like the plumbing is in place. So I agree with you. And there's gynecologists for a reason. I mean, I could tell you so many stories, Marley. I did a talk not long ago with a bunch of highly educated in Los Angeles, actually at a talent agency, women. It was a breast and ovarian cancer awareness thing. So mostly mid-30s, women working, blah, blah, blah. Many of them had never seen a gynecologist. Many of them had no idea, obviously, that Pap smear didn't detect ovarian cancer, but had never seen a gynecologist before. And some of them were virgins and they're like, why would I see a gynecologist? I've never had sex. And I was like, I don't know, maybe because you're 32. So many things. And afterwards they all said, well, what's the one piece of advice you would give? I said, please have a gynecologist. Please see a gynecologist. Yeah. You go to a dentist, you get your hair colored.
Experience. Like for me, I knew that at a young age because my grandmother had BRCA and she died at 42 of ovarian cancer. And my mom, so she had a hysterectomy right after she had me. It was before they could test for BRCA. So she was at like Revlon, UCLA. She went there.
How did you know your grandma had BRCA?
We know now, but we didn't know then because we just knew, of course, she had breast ovarian cancer. Her sister, my grandma's sister, then had breast and ovarian cancer. And my cousin on that side also had breast cancer at 30. So then my cousin was able to get tested and she was positive. So we figured, but my mom didn't know at the time. So she got a hysterectomy and she, starting at the age, her hysterectomy, I think was at like late 30s and then mid 30s. And then from there, she just kept getting checks every 6 months at UCLA. And then she was finally able to get tested. And fortunately, she wasn't a carrier. But that was always kind of, and I myself get a mammogram every 6 months and an MRI every 6 months. Well, trade. So I do once each year.
Have you had genetic testing?
I have not had genetic testing now. I still have to do that. But my mom was negative. So they were like, you don't need to do it, but I'm going to do it soon. But I do the screening, like I said, the MRI and the mammogram and ultrasound every 6 months.
Okay, this conversation could go on for about 17 hours right now because there's so much we could dive into. I will end it now because we could talk forever and I would want to have dinner with you next time I'm in Los Angeles, but I love it. I would highly recommend you get your fallopian tubes removed.
I did.
Okay.
I did.
Okay, good.
I did.
That is a huge risk reduction for ovarian cancer.
Or a laparoscopy for endo, and I had it at with an oncologist. He did it, and I said, take out those fallopian tubes, so they are gone.
Good for you. It is a huge risk reduction surgery for ovarian cancer. You don't need them, clearly. And, the biggest thing is then you're sterilized, which doesn't really, obviously it's not gonna be a big deal for you. And you don't need them. They don't, it has nothing to do with estrogen reduction, blah, blah, blah. And it's the easiest surgery, as you know, done laparoscopically, outpatient.
Because that's why I did it. Because I heard the doctor was like, it's a reduction in risk. You don't need them. So I was like, yeah, let's do it. So I'm glad that you also have heard the same thing.
Oh, of course. In fact, yes, I had mine done at age 40. And in fact, a lot of the research about having that majority of ovarian cancers start in your fallopian tubes actually came out of our preventive care clinic at USC.
Wow.
Done under the guise of Dr. Linda Roman, who's a gynecologic oncologist at USC, who's the director of our clinic there. Yeah.
I need to pick your brain too. There's so many things for us to discuss.
This is a lot. Oh my God. From fertility to ovarian cancer, and your grandma died of, oh God, I'm so sorry. This is a lot. Wow. Well, you're amazing.
You are amazing.
So happy.
I'm so glad. Now I'm wishing we would have been able to do it in person.
I know. We would have been chatting forever. I know. Or maybe not, because I never would have let you leave. This is just wonderful.